What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, August 31st, 2023. We do have several news stories to share with you today, and we do have some weekly data that just came in, which I can tell you as of right now, you do want to stay tuned because some of this data is not good. We're seeing numbers continuing to rise in some states. It's not something that we want to see. Starting off today, remember when we reported on that John McEnroe, who was an analyst for ESPN, tennis, the U.S. Open is going on, he tested positive for COVID. Well, it seems like a lot of tennis players themselves are starting to get sick. It's not stating whether or not it's COVID, but it says here a mysterious illness sweeping U.S. Open perplexes tennis fans as multiple players are dealing with illness. And again, we don't know if this is COVID, but it is clearly impacting their play. And from what I'm hearing, the coverage on TV, they're not making too much mention of this. Maybe they did today, but up until today, there wasn't much mention being made about this. So this is not good. The U.S. Open for tennis, it's one of the biggest tennis events of the season, and that's not good. So we'll find out what goes on. I've been seeing pictures there where the crowds are just humongous. So it wouldn't surprise me if we find out, oh, this is COVID that's going around. Speaking of COVID, the U.S. tennis, that's happening in New York. Let's go on the opposite side of the United States to Los Angeles, where we have a Jewish day school that is dealing with a COVID outbreak in Los Angeles. And apparently this is pretty serious because they had to reinstate mask guidelines. They're saying, no, you need to mask again. If you send your child to school without mask, your child will not be allowed to come to class that day. And yes, that's exactly what they're doing because the CDC has declared that the outbreak at this school, it's an actual full-blown outbreak. The CDC has declared it one. So because that they've been declared an outbreak, the school's saying, you know what, we need to put some precaution and safety measures in tact, and that is masks again. Some people are not happy with that, but it's what needs to be done. When you have an outbreak, you need to get it under control, and rather than close, that's what they opted to do. Speaking of outbreaks and people testing positive, let's make our way back to the East Coast again. Yale University, the president of Yale, Peter Salovey, has tested positive for COVID-19. Now, there was something rather interesting that I saw in this article. While it says he tested positive, I think it's safe to say that he's not going to be the only person who tests positive. Follow along with me here. Read this. More than 2,500 attendees, including members of the class of 2027 and their guests, gathered on Cross Campus on Monday, August 21st, for this year's opening ceremony. But one of the annual event's usual speakers, University President Peter Salovey, joined virtually after testing positive for COVID-19. Let's repeat that again. More than 2,500 attendees. I don't know whether that was outdoors or indoors. I don't see any pictures of this. But what I do know is when you have 2,500 people gathered together in a surge, and you know darn well there's probably not a lot of masking going on at that event, there's likely to be at least some COVID cases. We'll keep following this. We'll see if we can't check wastewater in that area as it evolves to see how many cases come of this, or try and get a sense of how big the outbreak is. We could probably also search it on Twitter. There's various different ways we can search to see if people are chattering about people getting sick at Yale, because it's a good chance that that's going to happen. COVID-19 update. 3,484 new cases reported in New Zealand. Yes, we haven't reported on New Zealand in a while. See, I told you we would do some international today, and we will do some world O-meters numbers today as well. New Zealand also added 22 deaths, so that's not good as well. And look at this. It says 1,451, or just over 40%, were reinfections. So they're actually tallying their reinfections together. Something I really wish should just be the normal in the United States. You still have states like New York State. They leave out reinfections. I don't know why. They do tally them, but in the daily number that comes in, that daily number that we're going to be doing in just about 3 or 4 minutes, yeah, they leave the reinfections out, and then on Wednesday come the reinfection. No, it all needs to be totaled together in the same number, and that should just be guidelines across the United States. CDC needs to put that in the guidelines, but CDC doesn't really care about data quality anymore. All right, let's come to Pennsylvania now. This is from the Philadelphia Inquirer. Yes, I'm a subscriber of the Inquirer. Philadelphia sees slight rise in COVID hospitalizations, but that's not why we want to see this. Yes, we do care what's happening in Philadelphia. There's a total of 60 people in the hospital. That's actually still fairly low. But what we do want to see here is they actually talk about Pennsylvania, which, as you know, if you're a fellow Pennsylvanian like myself, you know our state does not report numbers anymore. You just can't get numbers. So we do get a bit of data in this. In Pennsylvania, weekly COVID hospital admissions rose from 281 cases on August 5th to 403 cases on August 19th, the most recent week for which data are available through the Center for Disease Control. Now, follow along with me here. It says there were 1,453 COVID hospitals admissions reported in the same week of August last year, according to the CDC. Okay, I get it. It's lower. But here's my issue with that. It's great that it's lower, but you know what? Let's just hold off on comparing to last year, because guess what? Numbers haven't stopped rising yet. Until these numbers stop rising, I'm not totally convinced they won't stay lower than last year. No one knows how long this is going to keep rising. Remember, BA 2.86 is waiting in the wings. Should we have a BA 2.86 wave, and this doesn't just go for Pennsylvania, this goes for around the country. Should we have a wave for that after we're done with EG.5 and FL 1.5.1, guess what? These numbers would only keep going higher. And remember, it's back to school. We've already seen numerous cases. I just did a thread last night of all the things that are being disrupted right now by COVID, and it's quite a few different things, with schools being the biggest culprit. Guess what? Back to school has not finished yet in Pennsylvania. Philadelphia doesn't start till next Tuesday. So the whole narrative of, well, it's still lower than last year. Yes, it is. And that's fantastic it's lower than last year. But let's just slow our roll, because we're still on the rise right now in many different places. I'll show you that in wastewater just a second. All right, now coming over to this. This is from U.S. News and World Reports. They talk about the top 20 places or COVID hotspots. I'm just going to read some states here that just pop out. Alabama has some hotspots. Lamar County. Mississippi, you have 3 different hotspots, with one being Clay County. Texas, 3 for you. Georgia has several. Look at all these Nebraska ones. And I get it. You're seeing a lot of red states here, although Rutland County, Vermont pops up, and Texas pops up several times. It's not about politics. COVID should have never been about politics. I get it. In this report, the red states are doing the worst, but you know what? The virus really doesn't care about how you voted. The virus comes to get you when you let your guard down, when you're out there having a nice good time, not thinking about COVID. Oh, COVID's over. It's not an issue. Man, that's just a cold or whatever. That's when it sneaks up on you and says, oh, you're going to make jokes about you? The joke's on you, because then you end up testing positive, and then you have a rough time with it. I mean, this is what's happening. There's people that are just not caring. And some of them, they're not even testing. They're not even thinking, oh, no, it's just a cold or whatever. And surprise, it's COVID. And because you're not testing, it's just continuously spreading around. Because right now, that's what makes these waves go higher. Just continuous spread. One person tests positive, then he spreads it to another person, then she gets it, and then this household gets it. On and on it goes. It's like dominoes. You know how dominoes go down? It just keeps going on and on and on and on. That's what's happening. And that's what's going on with this wave right now. Already enough with the news for one day. I was going to show this story about Deborah Birx, but changed my mind on that. Basically, Deborah Birx is basically saying that the CDC and the current administration, believe it or not, if you remember her, she was Trump's health advisor. She's basically saying that the CDC and the current administration is just basically not doing enough. Boosters should be coming faster. They should be doing more to slow the spread. So, and guess what? She's right. They should be. All right, take a look at this. The heat related illness. And as we know in the dark brown, it's much higher than average. And look at the South. The South is doing the worst right now. And the Pacific Northwest. North is not doing too bad, with exceptions for some of the Midwest. Moving on here, BA 2.86. Total number of cases continues to increase. Total is now at 34. Denmark now has 10 cases. The United States of America, our country, has 5. Sweden 4. South Africa 3. Portugal 2. United Kingdom 2. And the following countries have 1. Canada, France, Germany, Israel, Norway, Spain, Switzerland, Thailand, all having 1 case of this. So this number continues to rise. Probably by this time next week, I suspect it'll be double this number. Remember, the United States is not going to report much in the way of data over the holiday weekend, but it's not a holiday weekend in the rest of the world. At least not that I know of. There isn't any holidays going on in the rest of the world, so we should get more data from around the world. And this is something of good news. Look at air qualities today. The Northeast, fantastic. The Southeast, a little bit concerning. Central states, a little bit concerning. Then you come to New Mexico, Arizona, Utah, Colorado, Wyoming, Idaho, Montana, not too bad, although northern Montana's bad. Then we come out here to California. Wildfires. That's where it is problematic, and it's problematic up in Canada as well. But again, good to see good air quality in the Northeast right now. And in the Northeast, that should continue into the holiday weekend before we start to see air quality. It's going to go down a little bit next week because there's going to be probably one of the biggest heat waves or the most powerful heat waves of the season. Yes, I know. Post Labor Day, who would have thought? Coming to the Northeast next week where it's going to be extremely hot. If you want to learn more about climate, weather, how it impacts our health or weather in general, I do have another channel for that. Haven't been getting to post on that as much as possible. I don't think I'm going to get anything out on that today. I've just been busy. When I'm not doing these reports, I'm either out of work or doing something else, updating the website, you name it. Just haven't had time to update the climate channel. I hope to get something out at some point this weekend because it definitely deserves a video. It's an important thing. We just had Adalia down in the south. Taking a look at the national positivity from Walgreens, 43.6%. That's down by 1.3%. Total testing is up this week, 5,238 total tests. Already. Something else that is up, wastewater. Take a look at this. So we saw the correction the other day. Now we're getting a weekly update. The Northeast and the West Coast are on a continued rise. There was no, remember we thought it was leveling a little bit? Yeah, it's continuing to rise. Now the South is starting to drop a little bit, which kind of makes sense for this time of year. Usually August, the middle of August to the second half, the South usually peaks, but I'm not convinced that they actually did peak because we've been seeing all these corrections lately. The Midwest was dropping, and look at this. It's going right back up again in the Midwest. Speaking of the Midwest, we're going to have data from Ohio here in just a little bit. We will get updates from the CDC wastewater page tomorrow. Now let's take a look at a few of those sites that show other things, not just COVID. And what do you say we come down here to Boston? I'm going to move myself to the left for this next few segments. And wow, Boston COVID is just rapidly rising. That's not good at all, because we do know a lot of people from Metro Boston will make their way up to Maine or head out to Cape Cod or head west to New York State for the holiday weekend. So, because of that, a lot of these tourist towns, it's very well possible you'll have people coming to your town who may be spreading COVID, because look at the wastewater in Boston. It is literally going straight up. And this is not just, oh, it's Boston. Oh, maybe it's not that big of a wastewater site. No, my friends. 2.4 million people, and it's going straight up. That is really, really bad. And this doesn't include private wastewater systems, although, in a major city area, you don't see as many of that. But again, that is going to be a problem, though, because some of these towns, these areas, resort areas, these vacation areas that people are going to go to this weekend, like, for example, Maine. I'll give you a prime example. I was in Maine earlier this summer at my relative's place. Prime example. They have a house on a lake, a summer home on a lake, and it's a private septic tank. And there's plenty of wastewater treatment, sites there, but guess what? It's private. So if there was COVID there, guess what? It's not being detected by the wastewater treatment facility. And you got a lot of places like that in Maine, Vermont, New Hampshire, places that people are going to be going this weekend. So this is not good, and parts of this wave that's going to continue through the holiday weekend could be hidden as a result of that. Taking a look here at influenza. Influenza is low. RSV is low. Both not an issue at this time. HMPV not an issue. Mpox not an issue. Norovirus at this time, it is dropping to holding steady now. But again, our big concern is, people are going to be traveling this weekend. And one thing that could happen is with people going away on Friday, some will leave today, people coming back Monday, COVID spread. Okay, wow, wastewater's really high here. Well, the people that had COVID were there for the weekend. Some of them went back home, or they picked it up and brought it back home with them. So it's going to be moving all around throughout the holiday weekend, and that is super concerning. Let's be fair here. Let's be very fair here. We did Las Vegas the other day. Wish I could do somewhere in Washington and Oregon. I can't, though. There's no wastewater sites there on the site. What's going on in the Bay Area? How about we come down here to, what is this? Wait, how about Oakland, California? Okay, so the overall trajectory here throughout the summer has been up. It briefly went down to start August, but it's been going up, and it's a little bit flat now for COVID. And taking a look here at influenza, not an issue. There was some RSV issues. That's since dropped. HMPV is not an issue now. Mpox, not detected. Norovirus here. It's there, and it's just holding steady at this time. Alrighty, moving on. We do want to take a look at this. Hopefully this updated. It didn't update at the time I started doing this update. No, it still hasn't updated yet. This is the emergency department visits, but we do know there's been 15,067 admissions this week. I hope to show it to you tomorrow if we do another pandemic update like this. I'm hoping we will. We'll just have to see how my day goes tomorrow. EG.5 is the top variant at 20.6. FL 1.5.1 is at 13.3%. We'll get another update on that again tomorrow. Taking a look now, let's see, did we get Chicago's update this week? I think we did get an update out of Chicago. Let's see here. It should be in by now. Yep, hospital beds in use are up 1.4%. Emergency department visits are up 1.4%. And what is this here? Giving it a green light, meaning down on hospitalizations. They're down by 11. Laboratory confirmed cases. Daily average is now at, yikes, this is not good. It's now at 150. That's up. And it looks like deaths daily average is 0.14. That's up ever so slightly. Vaccinations administered is down this week. New Jersey, speaking of being up, New Jersey hospitalizations, they are up ever so slightly today. No, they're actually down by 1. Okay, apologies. See, they always keep correcting the data in New Jersey. I don't understand what the deal is. I guess as more hospitals report on a day, they report what the numbers were in the previous days, and that changes things. But it's 362. If I'm not mistaken, that's higher than the number we saw yesterday. 69 versus 70 hospitals reporting. Still one hospital did not report. I would assume going into the holiday weekend, we are going to see a big drop-off in the number of hospitals that report, but what do I know? 759 EMS incidents in Philadelphia. Let's do a live look at the suburbs. I can tell you this morning, I saw a ton of ambulances in Montgomery County. That's the county I was in all morning. Total EMS incidents right now is at 13. Let's take a look at Chester County. Chester County is pretty busy. Sick person, sick person, sick person, respiratory difficulty, stroke, seeing all kinds of different things. Exposure to heat, cold. Not sure what they actually mean by that one. They have sometimes a county what might mean something in one county means something different in another county. Like sometimes sick person can be just a general illness. It can be doesn't necessarily mean, oh, they have COVID, they have flu, they have a cold. Could also be something cancer related. Because I've listened to dispatches and it's just weird how every county does it differently. Let's go up to New York State now. And let's make sure this is the most up-to-date number. I believe it is. Yep. 1,553 new cases. The test positivity is 16.3%. The 7-day average is 15%. So, yeah, everything's rising here. This is not good. Hospitalizations in New York State. Let's zoom in to get you the most up-to-date number on that. And the hospitalizations for New York State, as you know, overall, they have been rising this summer. Today, they actually dropped a little bit. 1,114 and 110 people in the ICU. And how about New York City? Is New York City dropping? Yes, New York City dropped ever so slightly as well. 493 people in hospital, 61 people in the ICU. Alrighty, folks, drum roll please. Ohio. Ohio is in. And Ohio's cases, well, they're higher this week. It's 7,821 cases, 171 increase in hospitalizations. We don't have a total number of active people in the hospital. They just do total since the pandemic started. I don't understand why they do it that way. ICU admissions, 5 were admitted to the ICU, and they've added 15 deaths in Ohio. And now let's come to Colorado. Colorado this week is seeing yet again another increase in cases. 1,920 cases this week. That's a lot of cases. That is not good to see. Do we have anything else? Yes, new hospital admissions are up by 11 to 145. 112 people are currently hospitalized. Yeah, you get the idea here. I'm looking for deaths. And let's see here. They have a total number of deaths, which is at 14,771 deaths. And now, I'm not seeing new deaths added this week. I don't know why they're not doing that. Maybe it's somewhere else here that I don't know about. But again, Colorado is rising. And briefly, let's take a look at the international numbers. And you can see here, South Korea is down 45%. I'm going to move myself back to the right so you can see this better. South Korea is down 45% on cases, 38% on deaths. Brazil, cases are up 27%. Deaths are up 1%, 122 versus 121. Romania, cases up 15%. Israel, cases are now up 170%. 1,572 versus 582. Deaths are up as well, 25%. 15 versus 12. Who remembers when the media that was like their golden coverage area? Oh, Israel is doing so well. See what we have to look forward to? Yeah, now they're silent when Israel's having a wave. They won't even bother telling you about that. Guatemala, 15% increase in cases, and deaths doubled, 4 versus 2. Chile, 89% increase in cases. Mexico, 49% increase in cases. And let's end today on Poland, where cases are up 14%, but deaths are just 1 death versus 2 last week. Alrighty, folks, that does it for today's edition of the Pandemic Update. We'll have another Pandemic Update, hopefully again tomorrow. Until I see you again next time, if you like this video, give it a thumbs up. If you want to see more content like this down below, hit that subscribe button. And if you know anyone that needs a reminder that the pandemic's not over, send them my way. I'd be happy to help convince them that, hey, COVID is still a thing. I will see you all again next time. But until then, stay safe, everyone, and have a great day. Thanks for watching.